cold and rainy day in Texas, so I'm going to go over how I use Nexium to treat and prevent my horses from getting ulcers. The generic name of this medication is esomeprazole magnesium. It's different from omeprazole in that you need a significantly less dose with the esomeprazole magnesium than you would with the omeprazole, which is why you need such higher doses in horses. That's what makes Nexium so affordable, is because since you don't need as much, you don't need to buy as much, you can get a 3-pack of these at H-E-B or the grocery store or Walgreens, Costco for about $14, and you're going to get 42 capsules. So the dosing is as follows. To treat them for ulcers, you're going to give them 60 milligrams a day for a month. Now, current evidence says you don't need a taper, but I still taper because maybe it's a longer duration of treatment and I see better results, and I just do it that way. It's ingrained in me. I can't change it. So you're going to do 60 milligrams a day for a month, and that's 3 of the capsules. You feed them every night at dinner, so every 24 hours at the same time. Okay, they don't need to be fed morning and night. It's just pick one with their morning feed or their nighttime feed, and then you do that the same time for a whole month. Then you're going to cut down, if you're going to taper, to 40 milligrams. That's 2 capsules. I do that for 2 weeks, same protocol as before. Then I'll go down to 1 capsule for 2 weeks, and then you can just go and give 1 dose a day, like the week of a show or going to a vet or schooling or any type of stressor, and you can use it like as a preventative, like GastroGuard, UlcerGuard. Therapeutic dose of this medication is actually 20 milligrams, so you're going to be treating the horse regardless. I top dress it on my horse's feed. Sometimes horses are picky eaters and you're concerned that they will pick it out or leave it. You can break the capsule open and pour out the contents of the pill into their food, and it will get to where it needs to go. If your horse is suffering from an ulcer problem, you should see pretty drastic improvement in 3 to 5 days. If you're not, maybe give it a couple more, but if you're not seeing a big night and day difference, then you're probably not dealing with ulcers and you should see your vet for something else. Also, you can talk to your vet about using this medication, but just know that since it's not an FDA approved treatment for ulcers in horses, they're not going to be able to recommend it to you as your veterinarian, but it is significantly cheaper. So you know, if there's a horse that is experiencing ulcers, but you can't afford a $700, and that was like a figure from 10 years ago, treatment to treat your horse's ulcers, then Nexium, you're not going to hurt your horse trying this, okay? And if you see improvement, then you know. There are studies on this matter where it has been tested on horses, and it has the same outcome as horses dosed with omeprazole. A good place to look for where all these studies are posted is on the Chronicle of the Horse. It's called Nexium for Horses if you search it in there. And it's just this huge master conversation. It's over probably a decade old, where all these questions are asked. The studies are posted. You can even go today, and if you have a new question, you can ask it, or you can say, does anybody else have this question? It's just horse people coming together to help each other. We're not claiming to be vets. This is just anecdotal. There is science to back it up. I myself had a horse scoped that didn't have ulcers after doing this protocol, and it was night and day difference for him. So I use it. It's $14. I mean, it doesn't get better than that. So if you have any more questions about how to use Nexium to treat your horse for ulcers, leave it in the comments.